This was a fascinating finding that we had in collaboration with the Gaucher's group at our hospital, led by Dr. Manisha Balwani, who's a genetics expert, and she has a large Gaucher's clinic. Usually these days, Gaucher's patients are picked up very early on in life, thankfully, and treated with enzyme replacement therapy or substrate reduction. Occasionally, patients are picked up later in life. Historically, there is a link between Gaucher's disease and an increased risk of myeloma, about tenfold at least, even in the setting of these treatments. And elegant studies done by Dr. Madhav Dhodapkar and his colleagues when he was at Yale showed that the reason for this was that the accumulation of glycolipids that were supposed to be broken down in Gaucher's disease caused an immunogenic response that resulted in this myeloma. So what we found was there were patients referred to us by Dr. Manisha Balwani that were picked up later on in the course of life that were actually having smoldering myeloma that was almost on the cusp of active myeloma, that to any other practicing clinician may almost have resulted in chemotherapy being given. We, instead of giving chemotherapy, held off and let Dr. Balwani's group give Gaucher's therapy, and this resulted in not just the Gaucher's getting better, but the myeloma getting better. As the immunogen went away, the myeloma also got better. And in fact, using biochemical assays, we were able to show that there was a link between the glycolipids that were being formed in these patients and the M protein that was forming the myeloma. So this was the fascinating thing, and this suggested that in patients that have Gaucher's and smoldering myeloma, there needs to be a very close interdisciplinary management, and one should not necessarily just pull the trigger on chemotherapy very early. There needs to be decision making that is done jointly with these experts, and perhaps some patients may avoid chemotherapy altogether, as we showed in these patients.